Hey guys, in this video I'm going to show you what you can do for your hand in your stroke recovery journey. No matter if you have complete weakness or if you have some weakness or if you are facing tightness and spasticity, this video will be useful for you. Usually in your stroke recovery for your hand, you will fall somewhere within this spectrum of what I just mentioned. So welcome to Basically Physio. My name is Suresh and I'm a physiotherapist. This video is going to be long, so I'm going to categorize you into three categories. First is the complete weakness. Second category is you have some weakness and some ability to move. And third category is you're having tightness and spasticity. For each of these, there are timestamps in the timeline below, so skip accordingly if you do not want to watch the entire video. So before we start, I want to talk to the viewer and I want to say that I see the effort that you're putting in. Just by the fact that you are watching these videos and by searching YouTube or the internet to watch videos like this, tells me that you are someone who takes your recovery and your rehabilitation journey seriously and you take ownership of it. This is the mindset that we need for a proper recovery journey. So I just want to thank you for showing up for yourself and don't beat up yourself when you have bad days. Bad days and good days are just part of the journey and just focus on moving forward. Okay? So don't be too hard on yourself. I really appreciate the effort that you're putting in for yourself and thank you for showing up for yourself. So for the first category where you have zero power, complete lack of power in your hand, our aim is to prevent any tightness from happening and also we want to preserve the joint mobility. And we also want to prepare the hand to start having some movement eventually. So how we are going to do this, we're going to focus on three things. First is the passive range of motion, meaning you're using a stronger hand to help move your weaker hand. Second is the sensory stimulation. We're going to focus on stimulating your hand using various objects and different textures. And lastly, we're going to focus on positioning your hand at rest so that tightness does not develop. So exercises for a zero power hand, you're going to use your stronger hand to help your weaker hand. Okay, so we're going to do some range of motion exercise for the shoulder and then the elbow. So first thing, for your weaker hand, okay, get it over your forearm, over your stronger hand. Okay, then your stronger hand, grab the elbow below here. Okay, we are going to go forward and we're just going to help, using a stronger hand, just lift up the elbow forward this way. Okay, it's going to be a bit heavy, so just do it gently. This hand is weak, right? So just place the thumb into the crease of your elbow so that it is kind of locked in position there. Okay, just place it like this, forward, okay, and down. Just do it to a pain-free range. Okay, so sometimes when you are very weak, you will have a gap down here. It's called a subluxation, and when you do movements above the shoulder or above 90 degrees, it will be painful. So be mindful of that. Just be gentle with yourself at this stage. So up and down like this. It will be tiring for your stronger hand because it's kind of lifting a very heavy and weak hand. So up and down like this. Okay, so do this for about 10 to 15 times. Okay, for all of this passive range of motion, do about 10 to 15 times. Try to do it 3 times a day at least. Okay, and down. If you want to go up a little bit more, what you can do is when you are lying down in a lying flat position, just grab your wrist here, straighten out the elbow and use the hand to push up all the way, and the gravity will help you to get it a little bit more, because when you're lying down, gravity is at 90 degrees, it will try to help you to extend your hand a little bit more further back for your shoulder. Okay, but that is different. I do not need you to focus on that. This is good enough for a start. So up and down like this. Okay, next movement, same position, your hand like this. Okay, we're going to swing your hand outwards. Okay, so same, your elbow here, the stronger hand is grabbing the elbow. I'm just going to open it up this way. Same thing, we do not need you to go all the way here. We are just starting with gentle movements first. Okay, so all the way here and back. Okay, push sideways and back. Remember, if you're having pain at any of this range, do not push beyond the pain. Okay, stop just before the pain starts. So same thing for this, you want to do for about 10 to 15 repetitions, 3 times at least a day. Okay, just be gentle with your hand, okay? Okay, Next, we are going to focus on your elbow. Okay, so for your elbow, you can actually grab your wrist here. You're just going to move it up like this and down. As you're coming down, try to extend it fully and then up. This should be relatively easier compared to the shoulder. Okay, and down. Try to keep it all the way straight like this and up and down. Okay, same number of repetitions and sets as your shoulder. So at this stage, it is very easy to be very demotivated, but just remember you can only do your best and try your best every single day. Put in the effort, and day by day you'll start to see progress, and eventually you'll have some movement in your hand. Okay, let's hope for that. Just do all these exercises diligently. Okay, up and down like this. Okay, for the next movement, it is going to be a rotation movement. So if you can have a table like this, okay, then you can just put your hand on the table like this. Okay, as you are doing, I just want you to turn outwards like this and bring it back in. Okay, just turn it outwards like this and bring it back in. So you can grab the front part of your forearm, push it out and in. Okay, you can definitely sit closer, but I'm not sitting because the angle will not be able to show you. So open it out like this and close it. Do not keep this angle here. This is too much for your weak hand. So really go closer before you do this. Okay, open it up and back in like this. Okay, if you find this video useful, do consider liking the video and subscribing to the channel. So for zero power for the wrist, this is your weaker wrist. Okay, you're going to put your hand like this. Okay, then you're going to focus on wrist extension. Okay, using your stronger hand, you're just going to move this hand up and down for about 10 to 15 repetitions, 3 sets. Okay, so really extend it and try to flex it forward. Okay, so extend. If you find that your flexion you cannot do much, then you have to change hand and come forward like this. Okay, then extend and then change and come down and bring it up. Okay, so you can do the extension first, then after that do the flexion. Okay, do it gently, don't need to do it fast, gently, and just be patient with yourself. Okay, don't push past pain, just be patient with yourself. Okay, then next you're going to put the wrist flat on the table here with the towel. Okay, then we're going to help move the wrist this way and then come back this way. Okay, this is side to side deviations. So this way and then pull the wrist back this way. Make sure your entire forearm is on the table. Okay, so go this way and come this way. So for each side you want to do for about 15 repetitions, 3 sets. So these are some of the passive range of motion exercises that you can do when your hand is at zero power. So next thing we're going to focus on is some sensory stimulation for your hand, and this is useful when you have zero power in your hand. So first we're going to start off with some massage over the entire hand. So just follow along, just doing simple massages like this. We don't have to put in firm pressure, just gentle massages throughout the hand. You can put your palm like this, resting on the table, and just massage all the way up and down. Okay, you want to do this slowly and gently and really feel the movement. Okay, so you can even go behind to your shoulder blade area as much as you can reach, and then grab your shoulder, the back of your hand for the triceps region, the biceps region. Okay, just do it gently and no need to put a lot of pressure, just gentle pressure will do. Okay, this is also to get you to kind of understand where your hands are and how it feels like when you're looking at it and touching it. Okay, so you can do this for about 5 minutes before you begin any of the rest of the exercises. Okay, so just gently go up and down, just giving some feedback into your muscles. Okay, hopefully this starts to fire up things inside your brain. Okay, all the way to your fingers, and your wrist, and your forearm. So as you're doing this, it's okay if you do not have any power at all. Don't be disheartened when you don't see any movement. It's okay. It will come back one day, and when it does, you have to be prepared for it. So that's what you're doing right now. Okay, so next I have a few equipments here. Okay, I'm going to show you. First is the hairbrush. Okay, this is just a hairbrush that you can find at home and you can use it. Next is a towel, a small towel, just to give you some different type of texture and feeling. And next is actually a sponge. This is mainly for like your doing your dishes. Make sure it's clean, and then you can actually use it to actually stimulate your hand. So I'm going to show you a few things that you can do. First, using the hairbrush, okay, placing your hand upwards like this, we're just going to go down 2 times. Okay, make sure that when you're doing this, you're not blocking the area with your clothes on. So just roll it up when you're doing this. Just go down 2 times, and then down here 2 times, and then to your wrist 2 times. Okay, and your fingers also. And turn your hand and do it upwards like this. Okay, do it a little bit more faster. Okay, and up like this. Okay, and then you turn back again. Okay, of course using your stronger hand to help your hand. Okay, now we go down a bit slower. 2 times here, and 2 times here, and 2 times here. As you're doing this, then you just turn around and do a little bit more faster, and then up like this. Okay, this is what you can do with the brush. You can do this for about 3 minutes, or just do it gently. Don't do it with a lot of if you do it with a lot of pressure, then it's going to be painful. So start gently first, and then if you can tolerate a bit more firmer pressures, then go for it. Okay, so this is the brushing. Next is you can either use a towel with different textures, or you can use this sponge here. Both of it also works. You can even use both of it one after the other. So next thing is also just getting your hand to feel all of these sensations. Something like a massage, okay? So you can do like a 2 times down, 2 times down, 2 times here, and 2 times here. Okay? So like how we did it just now. Palm up, 2 times down, 2 times in your elbow, and 2 times in your fingers and your wrist. And then turn around and just do a little bit more faster. Okay, so all of this as you're doing, just look at your hand. Okay, just look at your hand as you're doing all this movement and really see it moving through your hand, and really picture and visualize how it would like be to feel this. Okay, when you had your power in your hand and sensation in your hand, get those feelings back. Imagine how you feel like as you're doing these exercises. Okay, so lastly is with this brush. Okay, same thing, palm up. Okay, just down 2 times, 2 times here. Be a bit gentle, don't be too firm at the start. Okay, then turn around and up a bit more faster. Okay, so for all of these different type of textures, you can do for about 3 minutes at a time. You can do it up to 2 times to 3 times a day. It all depends on how much you can tolerate. But at the start, don't go too fast on it, because you might injure your hand because you're not used to all this kind of things. So slowly, gradually build up your tolerance to this. So now we're going to talk about positioning when your hand is very weak, okay? So a lot of times, if you do not position your hand properly, then when there is no power, a lot of times the muscles are going to get tighter, and in the later stages, it will go into a stiff position like this. And at this stage, when you start to gain power, it will be very difficult to overcome all of this tightness. So at the early stages, when you have zero power, just focus on positioning, because this is very important and it will help you in the later stages. So when you're sitting down like this, most of the time you might be wearing a sling, or you might just keep your hand like this to protect it. Okay. One mistake that this will cause is that it will cause your elbow flexors, that means your biceps, to be a bit more tighter. So when this happens, then it's going to be difficult to straighten out your hand. Okay. So when there's zero power here, okay, what I want you to focus on is actually getting a towel and a pillow. Okay. So just put the pillow here on the weaker side. Okay. Make sure this is rested here and your forearm is resting on the pillow here. Okay. And for your fingers, right, do not let it curl up like this. Give it something to hold, a towel like this, and just let it be resting in a natural position. Okay. And you can either put your palm down like this, or you can turn it out. So you can alternate between your palm facing down and palm facing up. So in this position, it is not going to be at 90 degrees, it is a little bit more further down. And this also is not going to be the ultimate resting position for you. You are going to move between positions, because staying in one position is also going to make it tight. So this can be your default resting position. And when you're resting, do make sure that you change this position. So you take off the pillow, okay, and just let your arm swing down like this to get the full stretch for your elbow flexors, okay, for your biceps, to get the full stretch. Okay, so as you're watching your television or going in a car ride or something, just let it hang down here, okay, for about a few minutes. And then after that, get back the pillow and put the hand back here. Okay, so you're going to alternate between these positions. Staying in one position is also going to be not very useful for you. So alternate between having this full extension and then just resting up your hand like this. Okay, main thing for your fingers, make sure you give it something like a ball or a roll of towel like this is actually good enough for your fingers to not become so tight. So for category 2, where you have some weakness in your hand, our main aim is to get your hand stronger and improve the control of your hand. How we are going to do this is we are going to do active assisted exercises and gravity eliminated exercises. So this is what I'm going to show you in this category here. Okay, so now that you have some power in your hand, you're going to use the help of an umbrella or something like a long stick. You can use it to actually use your stronger hand to assist your weaker hand in these exercises, okay? So we're going to start off with the shoulder and we're going to move it forward and also sideways like this, but with the help of an umbrella. So get something like this so that your hand can grab it. You don't need a lot of power to grab it, just position your hand like this and your finger should curl around and it should be easier to do this. So for this, the weaker hand, grab the top part of it and the stronger hand, grab somewhere near the bottom part of the umbrella, okay? Position your weaker hand forward and your stronger hand at the back. Okay, your stronger hand is going to drive this hand upwards like this. Okay, you don't have to go all the way up. Okay, the stronger hand is driving this hand up, but it is not the one that's doing all the movement. Your weaker hand is also trying to going to flex your shoulder. Okay, so just do it gently. Make sure that your weaker hand is also activating. Okay, do for about 10 to 15 repetitions and do it 3 times a day. So stronger hand is using this part of the umbrella to push, while the weaker hand is using the muscles to help, but the stronger hand is helping the weaker hand. Up and down. Okay, so forward and down. So the next movement is you want to sit forward a little bit and same thing, grab the umbrella here, the handle. Stronger hand is lower part and you want to open up your hand. Okay, don't have to go all the way up, just a little bit of a gentle opening here and down. So remember, your stronger hand is assisting the weaker hand, but your weaker hand also has to do some movement. It cannot just be not doing anything. So open it up like this and down. So really control the movement, okay? 10 to 15 repetitions, 3 sets every day. So for the exercises where you have some power for your elbow, okay, what you're going to do is you're going to put the hand on a towel like this and you're going to extend your elbow, so straighten out this way and flex it. Okay, so using the towel to reduce the friction, you're just going to do this type of a movement, really focusing on this part of your elbow here at the back of your triceps here. Okay, so triceps to extend, okay, and using your biceps here to flex it forward. Okay, so flex and extend. As you're doing this, be very mindful of the movement. Do it gently and do not use any compensatory movements from the shoulder. Really focus on the elbow, just bending and straightening it. Okay, so try to do this for about 10 to 15 repetitions and 3 sets. Another thing in a higher level, what you can do is you can actually grab onto something like a cup. Okay, shape your hand on a cup like this. Don't have to be perfect grasp, and use this. You can either fill it up with water or just be empty, just as a weight. Move that. Okay, extending and flexing. Okay, this is like simulating how to take a cup when you are sitting and eating your food, using your weaker hand to actually take a cup to bring it closer to you. So this is a very functional way to do the exercise and it will be much more meaningful to do with a cup like this. Same number of repetitions and sets. Now we are moving to your wrist. When you have a little bit more power, you don't need to use your stronger hand to help. In this position with a towel here, just try to activate moving your wrist up and down. Okay, sliding it with the towel, it should be a bit more easier because of the lack of friction. Okay, you do not have to do like a full range of motion. Just a little bit of upwards and a little bit of downwards is also good. Okay, just a little bit of movement like this is good. Be sure to isolate the hand. That means put your forearm here and don't move your forearm, just move the wrist. Okay, extend it up and down. Yeah, very good. Just like this and down. So when you're doing this, don't move your elbow like this. Okay, just focus on the wrist, up and down. Okay, next is you're going to do side to side deviation. Same thing, stabilize the forearm here like this, and your hand, your wrist, you're just going to move sideways, left and right. Okay, remember, when you're doing this, you do not need full range of motion. You may not be able to achieve full range of motion now. As long as you're moving it and you're seeing some movement happening to the left and right, that is already very good. Okay, just continue to work on it. It's like step by step, brick by brick, you'll get better. So same number of repetition, 10 to 15, 3 sets a day. Okay, now moving to your fingers. Okay, this is a little bit more difficult, but if you have the power to do it, if you have the strength to do it in your fingers, then go ahead for this. Okay, so what you're going to do is you're going to straighten out your fingers and place it on the table like this. Okay, next what we're going to do is you're going to lift up one finger and try to bring it, when it comes down, don't let it snap down like this. Okay, when you are here, try to hold the finger and bring it down slowly. Okay, lift it up. Don't have to yank it up all the way, just a little bit here. And slowly bring down your finger. Okay, this is training of finger extension. So lift it up and let go and slowly bring down. If what happens is like this, if this is what's happening to you, then using your stronger hand when you are in this position, help to control and bring down the finger. Okay, so you're using a stronger hand about 40% of the power, and your finger try to do 60% of it to bring it down slowly. Okay, if you're just going to use a stronger hand to do everything, then it won't be effective. Okay, you have to do it together, stronger and weaker working together. Slowly bring down. So for each of these fingers, try for 5 repetitions. Okay, this will be tiring and will be difficult for you. So another thing that you can do is to try to incorporate your hand into functional movements. So for example, if you want to grab this cup, don't use your stronger hand, use your weaker hand. So for your weaker hand, just try to open it up. Okay, open it up and shape it on this object here, for example this cup, and hold on to it and just move this forward and backwards. Okay, just sliding it on the table. Okay, this exercise is a very functional exercise and will be very useful for your hand, especially in this stage. The more you incorporate your hand into functional movements, the more motivated you will be, because this translates into your daily activities of daily living, right? So you'll be more motivated to do this type of movements. So as much as possible, try to incorporate it into activities of daily living wherever you can to move your hand. So this kind of activities you can do for about 10 repetitions. You can do for 3 to 5 sets every day. Okay, then you can also do in and out. Okay, all while your elbow is supported and your hand is supported on the table here, so it's easier for you. Okay, so one more thing, a little bit more harder, is if you can lift up the cup and place it forward, just a little bit forward and a little bit back. Okay, lift it up and place it back. This is a little bit more challenging, but this is the next level that you want to aim towards to. Lift it up and put it down. Okay, and lift it up and put it back. So as you are doing this, I do not expect you to have a perfect grasp over this. As long as you can close this, just use your fingertips to really tighten the grip and your thumb to go over. Just grab it like this. It doesn't have to be a nice grip, okay? As long as you grasp it and it's safe, then you can start moving it. Because in the early stages, we do not want to aim for perfect grip, because it may not be possible at this stage, but eventually you will get there. So just start with what you have first. So when you have some power on the hand and you are actually able to do a little bit of movements, when you are doing your daily activities such as getting food and bringing from the kitchen to the hall, some of the things that you can actually try to do is, instead of using a strong hand to hold everything, incorporate using your weaker hand also. Okay, so just grab the plate like this, and this hand you don't have to lift all of the weight. Hand can lift all the weight, but this hand is just like a stabilizing force here, and then walk like this. Okay, so same thing with a cup and same thing with a plate. Okay, even for other things like you are carrying your laundry clothes from the washing machine to the living room, so you can actually grab all the clothes, and you don't have to lift everything on this hand because this hand is still weak. You may not be able to hold on to all the weight, but it can serve as a stabilizing hand. This is very important because when you have some power in your hand, you want to make sure that you start using it as much as possible for your daily activities. Lastly, for category 3, where you are facing tightness and spasticity, our main aim is to reduce this tightness and to improve the joint mobility. How we are going to do this is we are going to focus on stretching, positioning at rest, and also weight bearing through the joint. I'm linking some hand braces down in the description below. Do check them out if you find that they might be beneficial for you. Before you do any of the stretches, you want to do some gentle massages over the hand here. Okay? So as you're doing this, I want to make sure that you are in an environment that is not so stressful. You are in a calm state of mind, and also you're not stressed out by any noises or any errands that you have to keep doing after this exercise. Okay, so you just want to be relaxed and calm when you're doing all these stretches, because if you're not, then it's just going to make it more harder to stretch it out and maybe even painful. So just gently massage over your elbow here. Okay, so all your muscles are very tight, just gently massage it. Okay, and then go up to your biceps. Okay, and up to your shoulder, to your deltoids, and then come down to your biceps. Okay, just like this. There's some gentle movements, even for your wrist if you can, and just, okay, if you can put in some of the fingers inside, then try to open it up a little bit, but we will get there. Just massage it first and try to get some stimulation to the hand first. Okay, over your biceps and up. Okay, if you cannot open your hand like this, and if you're like this is fine also. Okay, so in this position, you're just kind of massaging all these muscles that are a bit more tense and tight, so to prepare them for the movement later. Okay, you can do this also, no problem. Next thing what you want to do is you want to have some gentle movement. Okay, so using a stronger hand, grab your wrist and try to straighten out your hand a little bit more and let it come back. Okay, just, you don't have to go all the way straight, you don't have to do this. Okay, just a little bit of movement is also good enough. Okay, just a little bit forward, just to get some looseness over your elbow muscles here. Okay, so using a stronger hand, grab your wrist like this. Just try to open it up as far as it goes. Remember, if it's painful, then stop, don't continue, and then let it come back. Okay, push it down and let it come back. Push it down and let it come back. Next thing, if you can put your hand here like this. Okay, another thing you want to do is you want to try to open up your forearm facing upwards, meaning your palm, you want to be facing up. So when you're tight like this, you just want to open it up like this. Okay, just push your forearm outwards and kind of roll it up like this. Roll it out like this. Yeah. Okay, don't have to all the way here, no need to do that. Okay, just gentle movements. Okay, gently open it sideways. Yeah, be patient. You're not expecting things to be 100% overnight. This will take time. Okay, so it's a habit that you have to develop, and you have to do it day in and day out. And that is how stroke recovery is like. Every day you have to put in effort, and slowly you'll get there. So now that you have stretched out your elbow, okay, for this part of your wrist, how we're going to stretch it out is you want to put your wrist over the edge of a table here. Okay, and then using your stronger hand, okay, you're going to just try and pry out this thumb here. Okay, so using your fingers, what you're going to do is just going to slowly take out the thumb. Okay, it's going to be tight, do it slowly, for this stretching exercise, if you find any pain anywhere, do not push past the pain, okay? Just do it gently. If you're pushing past pain, then it's not good, okay? So once you have yanked out the thumb, you want to grab it like this, okay? Or you want to do like a handshake, okay? Grab the thumb like this, okay? In this position, using your fingers from the stronger hand, you want to slide into your other fingers like this, okay? Once you have done it, okay, so you are in this position and you are opening up like this, okay, so the thumb is being blocked by your stronger hand here, and then your fingers are opening up. Once you're in this position, of course you'll be curled up a little bit depending on how tight it is. Then you just bring it and place it on the table here, okay, table like this. Then stretch out the fingers, okay, really stretch out the fingers and place it here. Okay, this is your starting position where you're going to rest your hand like this. So no more like this, no more resting your hand like this. Whenever you have access to a table, you're going to stretch it out and place your hand like this. Do this for long periods of time, for 5 to 10 minutes at a time. If you can tolerate it, then do it for a bit more longer periods of time, okay? So in this position, what you can do is you can actually push down. You can push down your palm, your fingers, push down, and this will actually actually is like a weight bearing exercise. It will kind of like stimulate all the muscles around your hands, and also in a way to kind of wake up the nerves and the muscles in the hand, okay? So that is what you want to do. You want to put some weight, and weight bearing is also like a kind of like a natural stretching for you, and it's a long-term stretching, because if you're just going to do a stretching whereby you're holding with using your stronger hand, then it's going to be very tiring. But if you're going to use weight bearing, it's going to be easier for you. So just push down, okay? You can do for in a cycles like push down for 5 seconds and then relax, or maybe even just 3 seconds, push down and relax, okay? Push down and relax. So my angle here, my shoulder is a bit backwards, but when you're doing this at home, you can actually put your shoulder a bit more forward and the table is a bit in front, then you can do it like this, okay? Just for the angle here, my shoulder is in a bit awkward position, but you can actually bring your shoulder forward and do it, but just that I do not have the space here to show you. So like this here, okay? So now that you are stretching out your hand a little bit more, if it's no longer in this position, it's a little bit more looser, it might be in an awkward position like this, okay, or sometimes like this, it's fine, okay, as long as you are getting it a bit more looser. Once you have gained some range, you want to use this hand to kind of be like a stabilizer for doing things, okay? So for example, if this bottle you're holding on with your stronger hand usually, you can actually kind of shape your weaker hand around the object here and get it to hold the object, okay? So you can just use this as like a stabilizing hand. In another way, you can also use like a plate, okay? So for a plate here, usually if you just use your stronger hand to hold, this hand that is more tighter usually, you want to just position, okay, using your thumb and the fingers, okay, just grab it. You don't have to be a perfect grip, okay, just like a mini, as long as some of the finger pads are in contact with the plate, it's actually good enough. So as you're doing this, then you can use your stronger hand to support the plate with your foot and move around. So this is very important, because when you have tightness in your hand and you have been able to gain some range, you want to make functional use of the hand, because if you don't, then it is just going to go back into a tight position again. So as much as possible, try to incorporate your hand into daily functions. So now positioning for your hand when it's tight. So when you have spasticity and it's tight, right? So after you stretch it out, what you want to do is position your hand. So like what we mentioned, you want to put your hand out like this on a tabletop and really just keep it open, okay? As you're keeping it open, you want to put some weight on it. So periodically, as you're watching the television or just doing something in a seated position, in a surface like this, periodically just push down and relax. So push down for about 5 seconds and relax. Push down and relax. So when it's tight, right, when your hand is tight and you have spasticity, a few things to take note is that for your shoulder, you want to keep it a little bit more open. So this angle here is important. Instead of going in like this, you want to really stretch out and put like this, okay? So keep it open. and your elbow, as much as possible, try to be more straighter. Okay, it might be difficult for you to go all the way straight, so a little bit more straighter, about a few more degrees than your resting position. A little bit more straighter than that is good. Okay, and your fingers, try to keep them open. If they are curled up like this, it's fine. Okay, you don't have to be perfect and be like this. If it's curled up, it's fine. Just make sure that you are able to place your finger pads on the table like this. Okay, so keeping like this, just put some weight and relax, and put some weight and relax. So this will be your exercise for positioning when you have tightness and spasticity. So the mistake that people make in spasticity and positioning is that you just go into this position when you are resting and seated. Okay, so if in your wheelchair you have an armrest here, same thing, instead of a table here, just put this on your armrest and try to open up your fingers. It may not be as nice as a tabletop here, but at least you're opening up and grabbing something. Another alternative thing that you can do for spasticity is when you are in this position, you can give your hand something to place around, something to wrap around. Okay, so these are very natural objects that you are very used to be using previously before a stroke. So use these objects together with your positioning so that at least you are more aware of what to do with these objects. And also it may serve as a motivation when you start to see these objects moving and you using these objects. It may serve as a motivation also. So either just putting it like this or grabbing onto something and wrap your hand around it. We have come to the end of this very long video. Thank you, and I'll see you in the next video.